Alrighty, so today our YouTube live is going to be focused on perineal tears and also the perineal massage, whether or not it's beneficial and what you can do to try to help, decrease the risk of tearing. But first, let's talk about where the perineal region is, and then we'll learn more about that in regards to the birthing process. So, using the pelvic model here, I'm putting everything back on for you. When we look at the pelvic floor, our perineal region is going to be the space that is in between the introitus for women, which is the vaginal area, and the rectum. So when we are talking about the perineum, we are talking about this area through here, okay? It is like a diamond type of shape. And within this area, we have different muscles as well that sometimes may be impacted with labor and where women can experience tearing, and the severity of tearing itself will determine what structures have been involved. So when women say they've had tearing, it's always important to know the degree of it, because a grade 1 means that we've had very minimal. Grade 4 is the most significant, and we've had tearing down through into the muscle down towards the rectal region, okay? So it's extremely important that we know more about that. Now, when it first time moms who are, moms more so who are having their first vaginal delivery, I should say, that they are at higher risk for tearing. So things that we can do to help mitigate tearing, one may include perineal massage, which we're going to learn a little bit about today, both before you actually go into labor and also during labor in some instances. You also can use certain types of counter pressure in that area to try to help decrease the strain that is placed on the tissues. If someone is in a certain positions may promote and allow for more gradual descent and assist with the mom as she is pushing and also allowing for the baby to exit at the vaginal region itself. So being mindful that positions and also counter pressure in various ways can assist with decreasing the perineal tear. But the biggest thing is that we know that first-time moms are at the highest risk for having perineal tears. And if you've already had a tear, then your risk is slightly higher as well. If we can eliminate or minimize the chance of needing an episiotomy, that is extremely beneficial. So learning more about the perineal region and what you can do to try to help negate that option is very important. And I do want you to know that episiotomies are no longer the gold standard. So they should not be required with every single labor that's while mom is delivering vaginally, but it should only be used in certain instances. And that is because with the episiotomy itself, we are purposely adding in a cut. And as the tissue continues to stretch, it is possible that that cut that has been intentionally placed there can allow or cause for additional tearing to occur. So we found throughout research that it is better for the tearing, that if tearing occurs, it is better for it to be something that happens naturally just by the process, and also for us to allow for it to heal, which in those instances, depending on severity, may require stitches or sutures. So just being mindful that episiotomies are not something that every woman will need. So don't just agree if you don't need it. If there's a medical reason, make sure your provider has explained that to you. But now let's talk a little bit more about the actual perineal massage and what we know when it comes to research. Well, we know that it is generally recommended for women to begin perineal massage between weeks 34 to 35. And that can be used for different reasons. Some say it's to help improve the blood supply to the area. Others say it's to help desensitize, meaning to decrease the sensitivity of the area, because you're going to have a good amount of stretching going on in that vaginal region. But also, it is important that we know that just in general, women who are more engaged with perineal massages tend to be more engaged with their body is feeling, and also knowing when to express, hey, something's changing, something may not be happening as what I expected it to, those different things. So they're just more in tune with what's going on with their body, women who are performing those perineal massages. But what we know, what you heard me mention, between 34 to 35 weeks is when we recommend that when we begin this. I personally tell my mamas to start a little bit earlier, because once you hit 37 weeks, you are considered full term. And 34 weeks, 35 weeks may not give you enough time to begin to desensitize this tissue, gently stretch this tissue as well. So some women will benefit from beginning this a little bit earlier, closer to the 32 weeks. And as long as you have been cleared for intercourse and don't have any restrictions there, then this should be something safe for you to do. Now, with the perineal massage, it can be performed, like you heard me mention, before you go into labor, but it also can be performed during labor, and in some instances utilized alongside a warm compress. When it comes to perineal massage, generally speaking, this is more so performed by a midwife once a mom is in labor. So that way the midwife is able to help assist her manage the pressure changes and also manage the stretching of the tissue. And you heard me say performed by a midwife when a mom is in labor. This is not a technique that a doula should be performing either before or during labor. So this is not a technique that your doula should perform on you. And I can say that because I'm a licensed medical provider, I'm a physical therapist, but I'm also a birth doula. And I have to let people know that when I am serving solely as their birth doula, I can show you and give you the instructions using models, but it's something that I cannot perform on you because I am not your medical provider. So make sure that you are working with someone who's knowledgeable to give you the education on it. But if someone's performing this directly to you, make sure that they also have the education and training needed. So that way we can keep you safe. So with the perineal massage, what is happening? I'm going to use the vulva model here. What is happening with that perineal massage is that you are actually going to gently massage this area through here, both externally and internally. So you can utilize your thumb, gently inserting into the canal through here, and you're able to add a little bit of pressure. If you can see, turn to the side, my thumb coming forward, add a little bit of pressure to that area, and then also use the index finger where you're able to gently pinch. Now, as you're gently pinching, this may cause a little bit of discomfort. I don't want you to have pain, but the good thing is that you're able to manage what you perceive as discomfort. So you're in control of this. And as you do that, you're just going to add gentle circles. You can either pinch and gently move up and down as well. So the biggest thing that we're looking for is just the movement of the skin and the muscles, so movement of all those soft tissues. You can then even come out towards the side to where now you are moving away from the anal region and back up towards the labia, still adding some gentle pinching base pressure. And you can do that on both sides. I have some moms who, rather than using the thumb and index finger, they prefer to use the first two digits, so the index and the middle finger, and then gently insert those on the inside and use the thumb on the outside. But the biggest thing is that as you're doing that massage, you want to massage all the way around throughout this region here, okay? So that's going to be what's most important. And with this, you can do this perineal massage before labor as many times throughout the week. Some women strive for 3 to 4 times a week, just so that way they can get used to what the stretching feeling is going to be like, but also during labor as you need to. This technique is very effective in early labor, and depending on how you're progressing in active labor, it can be very effective at that time as well, especially prior to the baby crowning as things are beginning to expand. So remember, the perineal massage, massaging this area through here, the goal is to try to help minimize or decrease the risk of perineal tearing. Now, we do know that it can help to decrease the risk of tearing, especially those tearings related to 3rd to 4th degree, so the more severe tears that are down into the muscle. There is a chance that you still could have some tearing though, because this is not, by no means will this prevent every single incident, but it's definitely worth giving a try. So that way you can at least do everything that you can on your end to desensitize the tissue, mean decrease the sensitivity of the tissue through here, and also allow for your body to gradually experience that stretching sensation and improve your own self-awareness. So I hope this information when it comes to perineal massage was helpful for you. And let me not forget to mention, when you do this, you can do with or without lubrication. I personally recommend with lubrication just because it does glide a little bit easier. And if you're noticing increased pelvic floor tightness or if you're having pain, the lubrication can help to mitigate some of that. So go ahead if you try it. Talk with your medical provider to see if this is a good option for you when it comes to perineal massage. And you can start this when you're seated on the toilet, in the shower. You also can do this in side lying, on your back, whatever position you are comfortable in. There are many ways in which you can perform perineal massage. And the ultimate goal is to try to help decrease tearing so that way we can optimize your postpartum recovery.